Hello everyone, my name is Jared Fortunato and today I'll be talking about stroke. So, what is stroke and how do we define it? Stroke is a form of cardiovascular disease characterized by the loss of blood flow to a region of the brain resulting in brain damage, and this is also known as cerebrovascular accident. And the abilities controlled by the affected area of the brain such as memory and muscle control are lost, and the brain cells are deprived of oxygen during stroke and this causes them to die. There are two types of stroke, which is ischemic stroke and hemorrhagic stroke. Ischemic stroke is caused by a reduction in the cerebral blood flow, whereas hemorrhagic stroke is caused by intracerebral bleeding within the skull. In brief epidemiology, stroke is the third leading cause of death in the United States, and approximately 800,000 people are affected per year. Now, out of those 800,000, a stroke occurs every 40 seconds, and 15 to 30% of them are permanently disabled. 1 in 6 males and or females in the United States have a risk of a stroke, and men are more likely to experience stroke than women at a younger age. However, women are more likely to experience a stroke than men at an older age. This is due to an increased cardiovascular risk when menopause occurs or an increased lifespan. Now, African Americans are more likely to have a stroke compared to other races such as Caucasians, Hispanics, Asians, and this could be due to their diet or their level of physical activity. Ischemic stroke, and this accounts for 87% of all stroke cases. It's caused by clotting or embolism in the cerebral arteries, and this is due to a condition called atherosclerosis, which is the development of fatty deposits lining the vessel walls. There's two types of ischemic strokes, which is thrombotic and embolic. Thrombotic is an artery in the brain that becomes blocked by a clot developed in the brain, and embolic is a clot in the artery of the brain that did not originally develop there. It traveled from a different location within the body. Hemorrhagic stroke is caused by a weakened vessel that bleeds into the surrounding brain, and there's two types, intracerebral and subarachnoid. Intracerebral is the hemorrhage within the brain, whereas subarachnoid is bleeding in the space between the brain and the tissue covering the brain. Now, there's two types of weakened blood vessels that cause this, and this includes aneurysms and AVMs, or arteriovenous malformations. So aneurysms is the ballooning of a weakened region of a blood vessel, and if left untreated, the aneurysm continues to weaken until it eventually ruptures and bleeds into the brain, and that causes the stroke. And AVMs, or aka brain tumors, are a cluster of abnormal blood vessels, which ultimately rupture resulting in the bleed. And this accounts for about 13% of stroke cases. Now, signs and symptoms. Knowing the signs and symptoms is the first step to ensuring medical help is received immediately. And this includes numbness of the face, arms, or legs, typically on one side of the body, confusion and difficulty with speech, impaired coordination and vision, and headache. Now, an acronym that is important when spotting a stroke is FAST. First is face. So if you see a person asking them to smile, if you see them droop, if one side of the face is drooping, then that's a sign of a stroke. Another is the arms. So if you ask the person to raise both their arms, if one of them is drifting downward, then that is another sign of a stroke. A third one is difficulty of speech. So if you ask a person to relay or to say a simple phrase, but their speech is slurred, then that is another sign and symptom of a stroke. And if you see at least one of those or a combination of those three, then it's time to call 911. Now this is important because this could lead to permanent brain damage or death if the person is not being able to be helped with in a timely manner. Now for each minute a stroke is untreated and blood for the brain continues to be blocked, a person can lose about just under 2 million neurons, and a person's speech, memory, and movement can be affected. So physical and cognitive effects of a stroke. This includes aphasia, which is difficulty forming speech, memory deficits, spasticity. Spasticity is abnormally high muscle tone, which is limiting a normal range of motion. Now, hemiparesis is a weakness on one side of the body, the side opposite of brain damage, whereas hemiplegia is paralysis. There's also increased sedentary lifestyle and unable to perform ADLs, activities of daily living, such as getting up, getting dressed, going to the bathroom, these types of things that people do on a day-to-day basis. Now, effects on the exercise response. There is a reduced bone mass and impaired autonomic control. So the number of physiological changes that could impede how patients can respond to exercise. There's also reduced muscle fiber capillarity, abnormal glucose and insulin metabolism, and the last one, a shift from slow twitch to fast twitch muscle fibers. So slow twitch fibers are more fatigue resistant than fast twitch muscle fibers, and the latter is more likely to get tired more easily. And there's also a difficulty regulating heart rate and blood pressure with the effects on exercise response. Diagnosis. This is based on the signs and symptoms, and for obtaining a medical history, the risk factors for the stroke such as high blood pressure, smoking, family history, heart disease. The number 2, performing a physical and neurological examination, so the doctor would check mental alertness, coordination, balance, checking for numbness or weakness in the face, arms, legs, checking for confusion, trouble speaking. And then diagnosis tests include blood flow tests, electrical tests such as ECG, and imaging tests such as MRI testing and CT scan. Now for ECG, you can find the source of the clot in the heart that may have traveled from the heart to the brain that may have caused the stroke. Now the effects of exercise post-stroke. This controls cholesterol levels, so there's an increased good cholesterol. This also fights high blood pressure and controls weight. And this also fights depression, because this depression is common after a stroke, and becoming physically active will help with the stroke recovery and help patients prevent a second one from occurring. And there's also social barriers as well, as far as an effect on exercise post-stroke. Now, how do you manage stroke, and what are some of the medication that's prescribed for people who have strokes? Well, what's important is exercise. Exercise is paramount when trying to manage stroke, and managing the key risk factors is one of the most important things you could do after having a stroke. This includes high blood pressure, smoking, past history, family history of heart disease, atrial fibrillation, physical inactivity, and so on and so forth. Now, stroke does not usually occur alone. There's other factors that ultimately cause it. Now, if a person needs to have surgical treatment, angioplasty is one of the most popular options, and this requires a deflated balloon being inserted into the artery with a plaque or narrowing. And then once the balloon is inserted, it's expanded to compress the plaque against the artery walls, which is then followed by a stent inserted, as you see on the right-hand side, keeping the plaque compressed together against the walls. This leaves the artery open and allows the blood to flow to all the areas of the body and the brain. And for medications, this includes anticoagulants and antiplatelets, and also antihypertensives. Now for meds, it really depends what the patient is experiencing, which pretty much depends what the patient is going to be prescribed. For anticoagulants and antiplatelets, an example could be warfarin, antiplatelets, aspirin. Now for all these medications, this would be able to control high blood pressure and or manage atrial fibrillation among high-risk patients. Now for therapy, there's physical, occupational, and speech. Physical therapy is used to restore balance, coordination, and movement. Occupational is responsible for returning the patient back to normal lives and getting back to activities of daily living. And there's also speech therapy for patients to utilize as well. Now, risk factors. The top 4, age, family history, race, and gender, are risk factors that cannot be modified. They cannot be changed, no matter what. The bottom are modifiable risk factors that can be changed. For age and family history, for age, the older you are, the greater possibility of having a stroke, and family history of cardiovascular accident and or disease, and obviously race and gender are risk factors that you cannot change. Modifiable risk factors include blood lipid profiles and LDLs, HDLs, and total cholesterol, blood pressure levels. So if you're above 140 over 90 millimeters of mercury, that is also in the stage 1 or stage 2 phase. Physical activity levels, diet, diabetes, and also smoking. Smoking hardens the walls of the arteries, which is hard for the blood to pass through the body. So for my case study, the 55-year-old man that suffered from a stroke 1 year ago. So with the age, that is a risk factor because the man is greater than or equal to 45 years of age. There's no family history, but the 55-year-old man is a current smoker, so that is a positive risk factor. Even though the BMI was under 30 kilograms per meter squared, so he was not obese, he was, however, suffer from high blood pressure, 144/94, which is greater than 140 millimeters of mercury for systolic, and greater than or equal to 90 millimeters of mercury for diastolic. So yes, that is a positive risk factor, even though HDL and total cholesterol levels are below the threshold. So HDL's was not less than 40, and total cholesterol was not greater than 200 milligrams per deciliter. LDLs were greater than or equal to 130 milligrams per deciliter, so that is a positive risk factor. The patient did have impaired fasting glucose greater than 100 milligrams per deciliter, so that it was 110, so that is a positive risk factor. And he does live a sedentary lifestyle. And the patient is a high risk because even though that he had all those positive risk factors, the fact that he did suffer from a known metabolic disease such as a stroke did put him in the high risk category. The medications that the 55-year-old man is being prescribed or taking is aspirin. And the goals of what he wants to do is that he wants to quit smoking, he wants to improve his overall quality of life, and he wants to improve his muscular strength. And it's important to watch for heart rate and blood pressure levels throughout exercise because as the patient is exercising, there could be a dramatic increase in heart rate and blood pressure as the patient is exercising, whether it be aerobically or doing resistance training. So the exercise prescription, what I would prescribe for the client, for it would be aerobic training, resistance training, and flexibility. For aerobic training, a frequency would be 3 to 5 days per week, an intensity, low to moderate intensity of 40 to 69% of the maximum heart rate. The time would be about 15 to 30 minutes per day, and the type would be walking, like jogging, water aerobics, step aerobics, and also a stationary bike. For strength training, because this is including the client's goals, I would prescribe to be around 4 to 5 days per week at a low to moderate intensity. So this includes body weight, water exercise, and active motion. So I would not want to do free weights because it's important for the client to be able to do strength training just with his body weight before we progress to free weights. And the time would be around 30 to 45 minutes per day, and this could be split into 10 to 15 minute intervals. And activities, this could include arm curls, seated push-ups, chair stands, ball kicking, and stair climbing. Now, it's important to include both concentric and eccentric movements because concentric only training does not increase isokinetic strength, which is an adaptation to exercise rehabilitation in stroke patients. For flexibility, this is important, 3 to 5 days per week. As far as frequency, intensity would be below the point of discomfort. Holding the stretch for 10 to 30 seconds per stretch would be the time, and then the type would be any type of static stretching in yoga. For flexibility, the emphasis would be on stretching the muscles on the paretic side, particularly in the muscle groups experiencing spasticity. There's benefits include cardiorespiratory endurance, like improved functional capacity, improved walking economy, increased oxygen pulse, decreased submaximal blood pressure, and increased voluntary physical activity. For skeletal muscle strength and endurance, this includes increased isokinetic strength and improved upper extremity function. And then for flexibility, improved range of motion and decreased spasticity on muscles on the paretic side. So in conclusion, exercise is medicine. It's been proven in the medical field, the exercise science field. Exercise is truly medicine, and it can improve the overall health of the patient in helping them recover or preventing from the stroke happening again. And stroke still remains a significant cause of death and disability, and exercise is important in prevention and treatment of patients after a stroke. And it's paramount to understand the significance of the stroke recognition, which is the FAST acronym. And timing is everything. This could be a life and death situation because the longer you wait, the greater the chance or risk for patients who do suffer stroke that can have a permanent brain damage and or death. And these are my references. I just want to thank you so much for your attention and enjoy the rest of your day. Thank you so much.